Hi everyone, my name is Dr. Manjari Pofle and I'm going to walk you through the steps of SALSA as outlined in the implementation toolkit. If you aren't familiar with the toolkit, I will provide a QR code at the end of this video so you can access it. SALSA is a technique of surfactant administration and it stands for Surfactant Administration through Laryngeal or Supraglottic Airways. And you can learn to do this with many types of videos found on YouTube or this video that we're going to do right now. This video specifically focuses on an easy way to do this in NICUs that are in resource limited settings or even if you're a NICU who's doing it for the very first time. At the end, we will include a short segment showing how you can adapt this method to different settings. Let's talk about the equipment needed now. First off, you need at least one friend to help you. It makes this procedure so much easier. One person does the procedure and the other person is responsible for delivering the surfactant. But both of you are paying very close attention to the baby and watching how the baby tolerates the procedure. Next, you need some kind of supraglottic airway device, also known as a laryngeal mask airway. There are many appropriate sizes and you have to select what best fits your baby. Here are some examples. This one is the one which people are most familiar with. You have to instill air into a cuff to create the seal. This one creates a seal with a special type of gel that molds to the airway as it warms. This is currently the smallest size in this specific device. It recommends use in infants 2 to 5 kilos but has been used in smaller infants. Recognizing the need for smaller devices in NICU babies, currently we have a couple of other devices that may allow for more targeted sizing. These 4 devices here can be used in babies from 1 kilo to 5 kilo. This device is also made of a material that compresses easily and hence creates a good seal. You will also need some type of IV tubing or feeding tubing. The tubing needs to be cut so that it does not protrude at the end of the LMA. We typically want the end of the tubing 1 to 3 centimeters above the end of the device so that it doesn't protrude out and we don't want it passing through the vocal cords. I'm not going to cut this, but I'm going to show this one. This tubing is then attached to the syringe with surfactant. In this video, we will pretend that we're giving 6 ml of surfactant and we will be giving it in 3 2 ml aliquots. You will also need a bag mask ventilation device like this resuscitation bag or any AMBU bag. If you have cardiac monitoring or pulse oximetry, make sure that your baby is placed on this so you can monitor the heart rate and the pulse oximeter during the procedure. Usually the babies will tolerate this procedure well, but desaturations can be seen with any form of manipulation of the airway, and bradycardia is sometimes a complication of surfactant administration. This usually happens because of vagal nerve stimulation, and you want to be able to intervene and correct this if possible. If you have an NG tube in place, you might want to remove it for the procedure. We recommend removing it as you are learning how to do the procedure. Once you're comfortable, you can leave it in throughout the procedure. Before you remove it or before you do the procedure, take the contents out by using a syringe and suctioning it out of the stomach. We will replace the tube after the procedure is over or use it to check how much surfactant is in the stomach or if the baby has swallowed any surfactant. This is rarely seen, but it is possible with all kinds of surfactant administration. Remember that when we give the baby surfactant, we usually give about 10 times more, so it is okay to lose a little, and if you lose a little, your treatment should still be effective. As we perform the procedure, the CPAP remains in place the entire time. There's no need to remove support as the procedure is very quick and this just takes extra time. This allows the baby to receive PEEP almost the entire time as pressure will be given as you provide breaths to distribute the surfactant. Once the device is removed, your baby is immediately placed back on CPAP support. Also note that our baby is swaddled for increased comfort during procedure. Pain medications are not required with this procedure, but a comfort swaddle helps control any discomfort. If oral sucrose is available, it can be given as it does provide a mild analgesic effect. Give this a few minutes prior to inserting your LMA device. As part of all this preparation, make sure that some form of suction is available for removal of the surfactant. Occasionally, some surfactant bubbles can be seen in the mouth when the LMA device is removed, and you may need to suction those. Okay, so to now start the procedure. Position the infant supine with the head in the sniffing position. Aspirate the stomach contents through the OG tube and then remove it. The nasal CPAP can remain in place during the procedure. Select the right size device for the baby. For example, we will pretend our baby is 2 kilos, so we can choose the device for this size baby. So this one is 2 kilos, so we will choose this device for our baby. Now let's talk about placement of this LMA. Open the infant's mouth and grasp or push the tongue out of the way with your left hand. Insert the LMA with your right hand using your index finger to guide the LMA along the hard palate. You might feel just a little resistance at the base of the tongue. Use just a little bit of extra pressure to get over this, and it should sink right into where it needs to go. When you're unable to advance the LMA any further, you may stop. If the LMA you're using has a cuff, inflate the cuff with air around 3 ml or per the manufacturer's recommendations. If your baby is active, you may also hear air rushing through the tube as they are breathing through it. At this time, connect your umbu bag and begin giving breaths. You can also listen to confirm breath sounds in the lungs. If you have a CO2 detector, you can also put this on to confirm placement. Also check the baby's heart rate and saturations. If oxygen saturation is less than 90%, increase the FiO2. If bradycardia occurs, the LMA is likely too deep. Slowly retract the LMA until heart rate increases while still listening for bilateral breath sounds. If vital signs are stable, you can now give your first aliquot of surfactant. Pop the ambu bag off. Insert the tubing and give 2 ml of surfactant down the device. You can usually do this in around 15 to 20 seconds. Depending on how surfactant deficient the baby is, you may see some surfactant come up in the device. This is normal and will eventually be adsorbed. Remove the tubing and put the ambu bag back on. Begin to slowly bag the surfactant into the lungs. Typically, all that is required is around 10 breaths or 20 to 30 seconds. Keep monitoring vital signs during this time. If the baby is stable, give another aliquot of surfactant by repeating the same process. So pop off the ambu bag, insert the tubing, and push in another 2 ml of surfactant. Replace the ambu bag and provide another 10 breaths or 20 to 30 seconds of time. Repeat again as needed, but if this is your final aliquot, provide 15 breaths or 30 to 45 seconds of time. We allow this additional time to make sure that all the surfactant has been adsorbed before removing the device. We have 2 more ml left, so we will pop the ambu bag off, give our last 2 ml. And then give around 15 breaths with the ambu bag. Here is another brief video of some of our friends showing how easy this step is. Once this has been done, we are ready to now remove the device. This is really simple. You just have to pull it out. So you pop the ambu bag off. Just remember that if you're using a device with an inflatable cuff, the air from the cuff must be removed prior to doing this. As you're removing the device, note if any surfactant comes up into the mouth. If it does, suction the mouth. It is normal for some surfactant to be lost with all the methods. And remember that we give 10 times more surfactant than what is in a normal term baby's lungs when we give surfactant therapy. When the device is removed, the infant is back on CPAP and is now benefiting from this easy method of surfactant delivery. This entire procedure usually lasts less than 5 minutes, and once you're experienced, frequently less than 3 minutes. When the device is removed, the infant is back on CPAP and is now benefiting from this easy method of surfactant delivery. This entire procedure only takes 5 minutes, and once you're experienced, it frequently takes only less than 3 minutes. Some complications of this procedure include bradycardia, which is most likely due to vagal nerve stimulation. Sometimes there can be desaturations. It is recommended to stop the procedure if the baby has desaturations and bradycardia. Remove the LMA and bag mask ventilate the baby if the baby desaturates until the infant has recovered. Congratulations, you're now ready to SALSA. I now want to take a few minutes to show you how you can adapt SALSA so you can avoid positive pressure breaths and allow the baby to slowly absorb the surfactant as they're breathing on their own while just getting PEEP. If needed though, you can still give positive pressure breaths easily. To do this, you will first need to be using a T-piece resuscitator or a flow inflating ambu bag. You will also need a T or a Y connector. I'm going to be using a T connector, and we will add a multi-axis catheter to this to give our surfactant. I have pre-measured on the multi-axis catheter to note that I need to push it down to the purple line, as that is where it is safe to give the surfactant. I have already inserted the device. Once it is in place, you simply let the baby breathe spontaneously while you slowly push the surfactant. As you do this, you're watching for evidence of slow adsorption, like surfactant coming up the device. If you see this, you can slow your push rate, pause surfactant delivery, or give a few breaths with your resuscitator or ambu bag. If the baby has any significant bradycardia or desaturations, you can also easily give rescue breaths to help them recover. The time it takes to deliver surfactant this way is about the same as with the other method that we demonstrated. Here's a quick video segment of what this looks like in the NICU. I hope this instructional video was helpful to you. You are now officially ready to SALSA. Here's the QR code that will take you to the toolkit that will give you all the information you need to implement this in your NICU. If you're watching this on YouTube, we will also provide some links in the description below. Thank you so much. You're ready to SALSA.